Welcome to the Personality Couch podcast, where we discuss all things personality and clinical practice. I'm your host, Doc Bach, and I'm here with my co-host, Doc Fish. We're both licensed clinical psychologists in private practice, and today we'll be talking about what's trending in our culture and how it affects mental health. In private practice, we have our fingers on the pulse of the culture. What's trending on local and global levels also washes up on the shores of clinical work. People shape the culture, and the culture shapes the people. And in this symbiotic relationship, mental health topics and problems take center stage. Today, we're going to unpack 4 trends we've been seeing in this post-pandemic world, including the collective trauma from the pandemic, mental health diagnoses as identity labels, over-identification with neurodivergence, and self-diagnosing. My goodness, that is a lot to cover, so we better jump right in. All right, so to start us off, why don't we talk a little bit about this collective trauma that we've all experienced from the pandemic, as well as this kind of colliding of pandemic with polarization. Let's talk about that. What is happening in private practice that we're seeing?
Goodness. I mean, we're all more anxious.
Yeah.
We're all on edge. I think a good way to describe it is it seems like a trauma response, right? So fight or flight.
Yeah.
Some people, they hold up, they fled into their homes, they barricaded really. But a lot of people fought. They're maybe even still ready to fight. They're ready for battle.
Yeah, I've seen that too. And I think mental health professionals, especially, or anyone in kind of the public servant sector has felt that, has felt the effects of just this increased hostility. Everyone's ready to fight or flight from trauma. We're kind of shells of ourselves, like a protective shell that we're all interacting with, all of our rough pieces of who we are. But I think along with that has come this distrust of authority, distrust of power. I think we've seen in clinical practice just this kind of sense that patients are the experts. Like there's not the same level of trust that there was before in like coming to a professional, seeking treatment. Patients are coming in. I know what I want. I know what I need. I want it now. Unfortunately, has been a lot of hostility towards anyone kind of standing in the way of getting whatever is needed.
Right. Absolutely. So that makes so much sense because the pandemic happened and we have an entire system of authoritative individuals not knowing what to do, really. There's a lot of discourse there. No one can do anything about that. But then we have the frontline workers who are delivering the rules that come from higher above them, trying to treat in chaos. And I think this stems out of a sense of helplessness, right?
Absolutely.
It's the trauma, right? Are you on my side? Can I trust you? I can't trust the world. So how can I trust an authority or someone above me? I think it just, I think it might have been you who said like, it's like a snow globe and we just shook it up.
Yeah, I did say that.
Yeah. So I think that's where it comes from. Despite where it comes from, it's not helpful.
Yeah. And I think in the pandemic, like it exposed the broken systems within the healthcare system and how fragile it really is.
Yeah.
With that, I think there continues to be kind of a blaming of the individual, like the workers are the face, right, of the system. We're working in the system. We didn't create the system. We have to follow the rules because
Right.
of HIPAA, licensure laws. I mean, but it's like all of that hostility and blame for not getting needs met, for the pandemic happening, for all the levels of uncertainty, that's getting pushed and blamed onto the individual that's treating you as the face of healthcare, when it's really the anger is at the system, just the broken systems. Well, that's what I'll say.
Maybe like an imagery, right? It's we go out, we go to work, boss yells at us, then we come home and we kick the dog. It's not the healthcare workers causing the stress. I think like the boss, whatever that represents, I think that's way more complex than just one person or one system.
Yeah.
But regardless, we can't fight that boss, whatever that represents. Mm-hmm. And so then it just comes out in the people right in front of us.
Absolutely.
Just like a child who acts out with the person that's trying to help them. That's kind of what we're doing. And unfortunately, those are the healthcare workers.
Yeah, absolutely. And even just beyond healthcare, I'm just even thinking of like any type of service. Chick-fil-A, for example. Chick-fil-A during the pandemic had to put out cones in their drive-thru that said basically, remember to be kind. Clearly, they're not just putting that there because they needed to spend money on cones. Probably because people were not being kind because they wanted their needs met now. So we're angry. We don't understand. This virus came out of nowhere. The world completely changed. Life shut down. We started shutting down. And we need some place to put all that anger and hostility. So we're going to take it out on the people trying to help us or serve us. And if it's not fast enough as we wanted it, like you name it, all of that harbored hostility is going to it's going to go right there.
So one research study found that violence and threats against public servants increased, obviously, substantially since the pandemic. 1 out of 3 reported harassment, threats, stigma, even violence. 1 out of 3.
Well, that's like multiple people within our small office. That's multiple people receiving threats statistically.
Mm-hmm. Have you seen that?
I absolutely have. Yeah. Yeah. And I've had people at my practice also report that. And unfortunately, it has come out towards clinicians, but also just the person answering the phone, like whoever's answering the phone. If it's not fast enough, if it's not the answer that you wanted, that we aren't able to treat that condition, or we have a wait list, then all of that anger and hostility comes out at the face. Mm-hmm. Like, our person answering the phone doesn't have any ability to change the systems, all the different things we're operating in. It's not his or her fault. Definitely have seen that administratively, clinically, not getting the diagnosis we want. That's huge. We're going to get into that mm-hmm. in a little bit. That has also led to increased hostility, sometimes threatening behavior as well.
Then on the provider side, the healthcare workers, there's an increase of burnout.
Yep.
Like a substantial increase of burnout. I believe there's one article that said it's increased over 20%. So
I would believe that.
Depression, anxiety, suicidal thoughts, PTSD.
Yeah, I think in that study, it was between 20 and 31%, depending on what it was. It was like PTSD, suicidal thoughts, depression, anxiety, like mental health symptoms as a whole went up, obviously because of we're also experiencing the stress and trauma from the pandemic. We're holding the pain of the people as well, and then getting, very hostile responses, threats in response. It only compounds the issues. And as a result, a lot of healthcare providers have decided or are deciding to leave the profession mm-hmm. Truly in droves because of the unsustainability of the threatening environment and the stress and their own mental health.
It's like getting hit from all sides.
The need for immediate gratification from patients. Like fix me now, doc, I'm in pain. And if you can't, I'm going to react. I think our culture has already trended that way. Like, kind of the supersize me. Do you want fries with that? Like, just a click of a button and it's delivered on our doorstep. We've already been trending that way, but with the increased pain and trauma, there's this like, make it go away now. And if you can't, I'm going to react.
I think that might bring us to our second topic. So there's a specialness that I think individuals are attempting to internalize or grab hold of. It ends up being mental health diagnoses seem to be identity labels.
Yeah.
Instead of like just labels. It's like part of the identity.
Yeah. It's like, because everyone is in pain, there's no validation. So people are fighting for these diagnoses like it's their lifeline. Like this is a buoy. If you're out in the ocean and you're trying to find something to stay afloat in the sea of chaos that we're living in, diagnoses are those buoys. And it's like, it's something to hold on to understand the pain, to make sense of the pain, to name the pain. And especially being personality disorder and personality spectra experts, we're all about naming. Like if you can name it, that disempowers it. But that's not exactly what we're talking about here. That goes beyond just naming it. There is power in naming, yes, but there is seemingly such a deep pain and a need for validation that there's this like clinging to these labels as if life depends on it. And when a diagnostic label is not met, like let's say they come in, they want an evaluation, they don't meet criteria for a certain diagnosis, all hell can break loose. Because that diagnosis is not met. That is a huge shift in our culture from where we were.
Absolutely.
Even just like 5 years ago. Diagnoses have not been something that we want. I mean, traditionally following the medical model, like if I go into a doctor's appointment after kind of Googling some symptoms or looking things up, I'm relieved if the doc is like, no, I don't think it's that. I think it's this or this. Because medical diagnoses typically aren't identity labels.
Right.
At least not, I've not seen that in the same way that mental health diagnoses have become that. It reminds me of something that I've heard you say, Doc Fish, about it being like the person becomes the diagnosis.
Right. So the diagnosis becomes like part of who we are. There's a word, it's called ego-syntonic. So it's in us, it's part of who we are. Instead of being outside of ourselves, which is ego-dystonic. It's different. We have this label, it becomes who we are. This is how we live. It's part of our identity. But really, and this can be more common with some diagnoses rather than others, but I think since the pandemic, it's been across the board. We are our labels. Instead of, oh, I'm a person who struggles with this. It's, I am this.
I'm curious what your thoughts are on this, but I think that perhaps it comes out of a place of like, wanting that validation for the pain, wanting to know that there's specialness in the pain. Because if we're all in pain, no one's special, right?
Right. It's like the baseline of pain increased and there's a new baseline for pain. So then it's like, am I in pain? I have to go up. I have to be above everyone. I get the image of like everyone's drowning and like we're trying to like step up on people and try to like grab for that lifeline.
In that, there's almost this celebration of victimhood that we're seeing, like we're trying to fight a battle. And I think this is where it gets challenging, because if we get stuck in that victim role, then the only way that we're going to see the world is through a lens of someone's persecuting me, or something, or someone's, and I need to be rescued. Like, we are forcing ourselves into a drama triangle. Now, I'm not saying that, you can't have repeated situations where you've been harmed or victimized or hurt in some way. That's not what I'm talking about. Sitting in this place of helplessness and I've been wronged. I'm entitled to something. I need someone to fix it for me. I'm being persecuted. If we are in that mindset, then we are not in a healthy place. And I think that's where we're seeing all this drama and hostility kick up, because when someone is sitting in that victim role of I've been hurt, I'm embittered by the world, then we are cast in the perpetrator role as the providers who aren't giving them the magic elixir diagnosis that's going to make everything feel better. That diagnoses don't do that.
The celebration of victimhood is what you're saying. Not that you can't be a victim, obviously, but it's staying stuck in that role. Maybe like choosing to sit in that trauma instead of healing. So getting stuck in that's going to completely bring out different personality flavors too.
Yeah, because if we have really pigeonholed ourselves into a corner of the triangle, the drama triangle. Triangles don't have corners, but you catch my drift.
Angles, obtuse or acute.
Yes, the angles. If we position ourselves like up against a wall, then there's always going to be someone else that needs to do something for us. We're not in control then. The power is in someone else's hands. But if we choose, like, yes, I've been hurt, I'm in pain, this experience has been traumatic for everyone, I have other life stuff going on, and this is what I'm doing to pull myself out. This is what I'm doing. These are the resources that I'm using to help me move forward up and out, versus waiting for someone to come, waiting for a diagnosis to come, waiting for a rescuer, and continuing to see the world through those lenses of someone's persecuting me or someone needs to rescue me. That is all personality flavors, which is why we're seeing a lot of personality disorders kick up now, because of the collective trauma experience and more, really more ingrained protective shells. Like, we become shells of ourselves.
Summing this all up, if people are their diagnosis, there's comfort in that it gives them a pass for engaging in certain unhelpful behaviors. So then, I think kind of stemming with that is the over-identification with neurodivergence, which also includes the autism spectrum.
Yes.
What are your thoughts on that?
Ooh, so this one, I would say, has definitely increased since the pandemic. Though I will say there was some seeking of diagnoses before the pandemic, though it seemed to be more resource-based. Like, neurodevelopmental disorders have more research behind them and more resources available. There's more publicly available information, resources for parents, for families, for kiddos and family members with both autism and ADHD. So really, before the pandemic, there was, and there still is, this hasn't gone away, but a seeking of ADHD diagnoses. I think because there's more information about it. It's one of the few diagnoses that has been destigmatized in our culture. And then, kind of kicking up with COVID and the pandemic was was autism. Individuals seeking this diagnosis in a way that is way out of proportion with the prevalence rates. So in 2023, at our practice, I'm guesstimating here. I don't have exact statistics, but I would say well over half, possibly 75% of people seeking an evaluation for testing, autism was on the docket as a potential diagnosis to explore.
I remember at some point, if there wasn't autism in the referral question or in the seeking to explore, it was surprising.
Yeah, it's statistically improbable that all of these people seeking these diagnoses would meet criteria. So that tells me that there's something going on culturally that's making people think they have this condition and they're coming in wanting to be evaluated for it. And even some of the language around that has changed. Like we've had a lot more people using language like, I would like a psychological evaluation to confirm this diagnosis, not to explore. It's like patients are the experts now. I figured this out, but I can't diagnose myself officially. So I need you to kind of be the notary for this diagnosis that I think I already have. What are some of your thoughts?
Neurodivergence is obviously it's outside the norm. So I think that goes along with the specialness we just talked about. But I think it also highlights how I think people are just feeling like they're not fitting. Like we don't fit in society. We're feeling socially awkward. Maybe something's off. Like something's significantly wrong. We are not feeling like we're in this box where we're supposed to be. Now you're talking about statistics. Per the DSM, 5th edition, text revision, so the most recent, 1 to 2% of the population has autism spectrum. But you just said we're seeing 50 to 75% of people seeking assessment wanting to confirm or explore. So that's a statistically impossible piece. At 50 to 75%, we can't all be outside that box, but I think we're feeling it. So I think it's now becoming like an identity label to belong, which inherently is not autism spectrum disorder, because there would be no preference to belong if you're on the spectrum. The social wiring is not intact. I think we're dealing with social wiring that feels frayed or lost its electrical coding, whatever that's called, right? But it's still intact. It's just distressing.
Right. Or something has come in and affected the connections, but the ability to connect is still intact. That's where we're getting into snags socioculturally with this definition. And something that you said made me think just in the term neurodivergence. So divergence, to divert, to deviate from the norm. So by definition, this is not the norm. From just a survey of what we've seen and what my colleagues are seeing, this has become the norm. Yeah. That is not even in line with the category that autism falls in. So unfortunately, we have this there's an at odds-ness with the sociocultural definition, or kind of what the layperson definition of autism is, and then what the DSM actually says. So what we see from trending on social media or whatever is at our fingertips on Google and then is brought in, oh, here's evidence, doc. Yes, I meet this diagnosis. I just need your approval. 2 different definitions we're operating under. That is a real problem, because clinicians are also getting caught up in that, and we're losing sight of our guidebook. Like, we have to follow it. Is it perfect? No. Do we need more research? Absolutely. In every category, we do. But we have to follow the same language. If we have the same name for different things. One thing is what we're calling it on the streets. One thing's in the DSM, and we're starting to use the street language. We're in really, I think, dangerous territory because it's hard to take that back once society goes so far.
So we're seeing an increase in diagnostic seeking on the
Yes.
client's part, and we're also seeing providers get caught up in that bandwagon over diagnosing. And like you said, DSM, not perfect at all. The text revision, so the newest one, actually is even more stringent on autism criteria than the previous edition. It's even more stringent. We can't all fit in it. So where does this come from? It was influenced by the pandemic. There's a disconnection from each other. So I think it's a reflection of the collective trauma, and we feel so different. I think also tech plays a part. So technology, right? We value technological relation a lot of times over in-person relation. So we're more apt to FaceTime instead of hang out in person. You don't necessarily need to go to the workplace anymore because you can Zoom. But then we're missing a huge human interaction piece. Goodness. So I think it's just, I think we're feeling maybe alone, disconnected, and in pain.
It's interesting because in seeking out this diagnosis and being attached to it, that even goes against the definition of autism, because someone with autism is not going to feel a sense of connection really at all. The hardwiring is not intact. So I think it goes back to attachment. If we're attached to a diagnosis, there's probably something else there. Trauma, potentially personality. We've got to look at those domains as well.
Well, that brings us to self-diagnosing. Goodness, this is a big one. We self-diagnose. We want the answers now. Amazon fast tomorrow, right? Like today, even.
Yesterday.
We needed it yesterday.
I wanted my appointment yesterday, doc.
And then we pair that with a healthcare system that is already taxed to the max. We can't meet all the needs, and all of the providers are leaving in droves due to burnout threats. And so we turn to Google, Dr. Google, social media, TikTok.
Oh, definitely. I mean, this is where all the kind of the 4 points come together in this last one about self-diagnosing, because we already live in a consumeristic society, even before the pandemic. I mean, that's how we roll in America. We want it fast. We want everything convenient. And diagnoses have become that because we want to ease that pain. We're desperate to quell that pain. Almost like diagnoses have become the anxiolytics. Anxiolytics are the meds that you take, like a Xanax or something to just quell that anxiety like that. Make the anxiety go away. And that's not the intent behind diagnoses, and we really just want everything like that, but especially this deep pain post-pandemic. Again, you mentioned the healthcare system being taxed because of reasons already discussed. We have the hostility. We have providers getting more threats than ever before, and more people stepping out saying, you know what, I'm going to do something else. So there's fewer and fewer people to actually do the work, even though the need is immense across the board in healthcare in general. But in mental health, there are not enough providers. Like we can say, based on our experience, like there aren't enough providers to go around. And so unfortunately, that has led big companies, often big tech companies that aren't affiliated with the healthcare system at all. These are not licensed professionals opening up their own shop or calling the shots, but big companies not backed by mental health professionals. They see a way to make profit. They say, oh, hey, there's a need there. We can make that work. And one study called this out, and it makes sense based on what I've seen too. But there have been companies that are propagating vague information through influencers online, influencers on TikTok, on social media, in order to get people interested in their products.
Oh my goodness.
By making them think they have diagnoses. So that's not ethical. It should not be legal. But this is where there's a huge chasm now in our broken healthcare system. Not enough people. The need is as great as it's ever been. And money-hungry companies are coming in and saying, we can fix that. We're already in an age where misinformation abounds. There's not a checks and balances system online. It's hard to tell what's actually backed in research or what's real information, what's from a mental health professional. They have new tags now on some social media channels. They're like, this is a verified mental health professional. But it's a real problem.
So one study, nearly 84% of the mental health videos on TikTok were found to be misleading.
Gosh, that's sickening.
That's a lot. Okay. We also found another study that less than 3% are actually from a qualified professional.
Yeah.
That is so concerning.
And if you think about the average TikTok user, so TikTok is where a lot of this stuff is happening, but it's other platforms too. But the average TikTok user is under 18. So we're right at our fingertips having misinformation. There's money-hungry businesses preying on our youth and vulnerable people to try to make money. Meanwhile, these hurting individuals are coming to us and angry at us for, we're the ones that are money hungry. We just do this for, whatever reason, when it's like, oh my gosh, this is so backwards. We're not the bad guys here.
There needs to be a label in order to belong.
Yeah.
We're finding that community online. We're trying to put a Band-Aid over maybe the pain from the social isolation.
Yeah, the pandemic exacerbated it for sure. It's complex. As with everything that we talk about on this podcast, there's never just like a one-stop solution for things. There's systems within systems and layers within layers that complicate things. And this is where my empathy kicks in. And it's coming from a place of hurt, like this behavior, this hostility, hurting people hurt people. And if we're all still wounded, we're inflated shells of ourselves trying to protect ourselves from this world. Hostility breeds more hostility. We've got to love one another and just be kind. Give someone a compliment, give them a smile. And, if we are really struggling with mental health, and many of us are, anxiety and depression are also at all-time highs, we've got to talk to someone. We've got to get in therapy. And if there's a wait list for therapy, get on it. I know there's not enough providers, but my goodness, if you can get on a wait list, keep trying. And if it's, not a good fit, try another one. Don't give up, because there are good people. There are people that are trying to help. We want to do this work. And honestly, that's one of the reasons why we did this personality couch thing in the first place, was to try to provide information that was accurate, to deliver it at a time that it's needed now more than ever, counter the misinformation.
I wonder if asking the question, what does getting this diagnosis mean, would also be helpful to figure out what is the actual need, right? Is it that you need to feel that community and you need a label for that? Or is it to find a treatment path? What is the reasoning?
Which that involves self-reflection. Like, instead of just reacting, reflecting on ourselves. Like, what is it I actually need? Tune into your channel. What's your body saying? What do you need? And what would getting these diagnoses or diagnosis mean? And is it just a substitute, like a name tag that you need to be a part of some online community or other community?
I think along with that would be increasing our critical thinking skills.
Yes.
So specifically, I think this applies to finding the information. Cross-referencing things that you find online, finding information from a qualified mental health professional.
Yep.
Right? Like perhaps this podcast and YouTube channel. But seeking out that accurate information, asking yourself, right, does it pass the smell test? Is this something that is put out in a factual manner? Or is it something that is put out to kind of draw you in and get you to relate to whatever it is?
Or even is it fear-based? There's a lot of fear-based stuff too, kind of preying upon our anxious selves right now.
Right. So increase our self-awareness. Maybe thinking about questions like, am I in a drama triangle? Am I stuck in that victim role? Do I want to get better? And then, of course, finding a community, maybe figuring out how you can develop your identity in a way that's not related to mental health. Okay, so sports, go join a meetup group, meetup.com, a choir, a run club. The world's open again post-pandemic, and there are hobbies.
There are other things outside of mental health diagnoses in order to have a community. Do something that you love. Find people that enjoy the same things that you do. But mental health diagnoses as identity labels, not necessarily the way to feel like you belong. We covered a lot of ground. And some of these topics might come up later in some other podcasts because they're big ones. Each one is its own big topic. But we had to get this information out. Oh, and before I forget, the different research articles that we referenced are also going to be in the show notes. So if anyone's interested in actually looking at those articles, those are available for you below or in the show notes, depending on what platform you're listening to us on. But for today, it's time to wrap up. So just want to thank you for joining us, and do join us next time as we dive deeper into clinical practice, personality disorders, as well as different personality types and structures. Be well, be kind, and we'll see you next time on the Personality Couch. This podcast is for informational purposes only and does not constitute a professional relationship. If you're in need of professional help, please seek out appropriate resources in your area. Information about clinical trends or diagnoses are discussed in broad and universal terms and do not refer to any specific person or case.